Welcome to Physician Focus. I'm Dr. Bruce Carlin. Alzheimer's disease is the most common form of dementia, a general medical term that describes a decline in a person's mental ability severe enough to interfere with daily life. The disease can have cruel consequences, robbing individuals of memory, motor activity, and the ability to plan and organize. Alzheimer's currently affects more than 5 million Americans, but the number of patients with the condition is rapidly increasing with an aging population. Estimates are that by 2025, 2 million more seniors 65 and older will be afflicted, raising the total to more than 7 million. While the effects of Alzheimer's on patients are slow and tragic, the impact of the disease goes far beyond the patient, to family members and friends who act as caregivers. This edition of Physician Focus will examine the impact of Alzheimer's on the family and caregivers. We'll look at such questions as, what should a family consider when confronted with a diagnosis of Alzheimer's? What difficulties will they face, and what resources are available to help them? With me to answer those questions are Dr. Susan Hardy and Dr. Brenda King from Summit Elder Care, one of 6 programs of all-inclusive care for the elderly, or PACE programs, in Massachusetts. Dr. Hardy is a medical doctor, board certified in internal medicine, with a subspecialty in geriatric medicine, and is associate medical director at Summit Elder Care. Dr. King is a clinical psychologist with specialties in health psychology and gerontology, and is the behavioral health specialist for Summit Elder Care. Based in Worcester and founded and sponsored by Fallon Health as an alternative to nursing home placement, Summit Elder Care serves residents of Hampden and Worcester counties and adjacent communities. Welcome, doctors.
Thank you. It's good to be here.
Thank you very much.
Well, let's start off with a definition. What is the difference between Alzheimer's and dementia? Susan?
Dementia is a general term that encompasses multiple diseases, all of which result in progressive decreases in memory and thinking and planning over time. Alzheimer's disease is the most common of those. It accounts for about 70% of dementia diagnoses in this country. And it usually starts with memory impairment and then gradually affects other parts of the brain and other functions.
So when I think about all my patients coming in, they're often asking questions, I can't remember this or that. When does it cross over to being dementia?
That happens when it's really having an impact on somebody's ability to perform the things they need to do every day. It's normal to forget a name, to forget where your keys are, to not know where you parked in the parking lot. It's more of a problem if you're forgetting your grandchildren's names and can't recall them, or if you're forgetting to turn off the burners on your stove and walking away. Those things are putting you at risk, and that's more likely to be concerning for dementia.
When does it become, how do you bring the families into the care of the patient with Alzheimer's? What's happening there?
Well, we always say we share the care. So oftentimes when families come to us, their family member is already having difficulty with some of those basic activities, either their personal care or things like preparing meals, transportation, shopping, and someone, usually their family, is helping them with those. And Summit is there to support the patient and the caregiver to help keep that person in the community as long as possible.
So you say that Alzheimer's is not a normal part of aging, but we see it more as you age, and you're recognizing this in a family member. And how do the patients come to you at Summit Elder Care? How does that happen?
Most of them are referred either by case managers, by their primary care doctors. Many people hear about us from other participants. So that's word of mouth is a very common way. And when someone thinks that perhaps Summit Elder Care would be the right thing for their family, or any of the PACE programs, then they usually contact us. A nurse will go out to the home and give the family and the patient more information. And to be eligible for PACE, you need to be 55 or older, to be nursing home eligible, and to be able to be safe in the community.
So as we're coming back on this, again, it's that, when does that crossover occur, when it's just sort of that benign senescent forgetfulness, to when does it become actually a disease process? When do we recognize it, and why are we saying so many people? Why are these projections of 7 million people? Why is that up there so high?
I don't know that we necessarily know why we have such a preponderance of the disorder, aside from the aging of the population. And the baby boomers are the largest cohort of people born, so we have a larger number at this time actually aging into the time when they might develop symptoms of Alzheimer's or dementia.
Do you think part of it is, in the old days, we used to die when we had that first heart attack, and now we keep you going with all sorts of equipment? Is that part of what's going on?
I think that definitely is. Most dementias are diseases of aging. Dementia of all sorts becomes progressively more common as people get older, and people are living longer now.
So as we come back, what are the early signs? What things should prompt some concern with the family and say, geez, we better look into grandpa, or we better look into grandma, and start circling the wagons and putting a team together?
As far as caregivers go, I think some of what people can keep in mind is that when family members or other people start to do things like shopping, preparing meals, maybe preparing meals ahead of time, knowing that mother might not be cooking for herself, or maybe not eating healthy meals if left to her own devices. So it's really about the activities that people do in a day-to-day life, that once that becomes affected and you find that you're doing an awful lot of helping your loved one, then that would be the time to consider.
So you find that you're actually watching the effect of the caregivers to determine whether or not the person is actually getting Alzheimer's. That if you're taking over some of those activities, that's your warning sign, your biggest warning sign?
I think a lot of times people with dementia don't necessarily recognize it.
I'm fine.
And and there's a loss of independence that happens that certainly nobody's going to, initiate. Nobody wants to lose their license or have to have somebody take care of them. And so aside from the inability to recognize it on your own, there's also pride and a need to maintain your own independence.
The independence.
Sure.
So what about the isolated person? I think we were talking earlier about how in a lot of these cases it's that we don't have the extended family and those anchors that people have to keep their memory in focus and so forth, so that you've got an isolated elder. How do we recognize it in there, or do you wait for the police to bring them in because they had some problems?
Sometimes family will notice, although many people are very good at covering up mild memory problems. But people may end up in the hospital because they're forgetting to take their medications. They may end up in a situation where they've forgotten to pay bills, and sometimes their family finds out about that or finds the unpaid bills in the house. They may be just losing weight. because
so
they're
you've
not
got all
shopping.
these
So-
other adjunctive things that that bring patients to your attention on
Right.
a fairly regular basis. So, given all that, what is the caregiver to do? What do you do when you suspect this? You know, here's one of these warning signs shows up. What do you, as a caregiver or as a family member, how do you move into the role of caregiver?
A lot of times people actually move into the role of caregiver without realizing that that's what they're doing.
Okay.
You know, it could be taking mom to, it could start out with taking mom to doctor's appointments and picking up groceries. And so caregiving for many people is really quite insidious. It starts off small. It starts off with a few manageable things that, you know, I can do or my husband can do or I can send the teenage daughter to do. But as a person declines, as a person with dementia declines, and families kind of, you know, rally round, then other people are doing many more of the ordinary functions of the person, and people become overwhelmed before they even, caregivers become overwhelmed before they even realize that they're spending so much time and energy doing it.
Taking care. One of the things that I see in practice is that you've got the one, quote, dysfunctional family member, and they said because, well, you know, sister's doing nothing, she can take care of mom. And one of the things that I often see, how do you deal with that over at Summit? You must have a few of those.
Yeah. Well, you know, we try and work with the family as a whole. I think for a family member, when you first think that maybe there's something wrong, the place to start is with the primary care provider. Often in a short office visit, the doctor may not pick up that there's a problem with the patient's memory. They ask them questions, they give answers that are appropriate. You know,
we're not as good at that as we think we are.
Yeah. But there are definitely simple tests that can be done in the office if the doctor is alerted that maybe there's a problem, that they can help start the diagnosis. I think knowing early is helpful. There are some treatments for Alzheimer's and other dementias, but even more importantly, it gives everybody a chance to plan and a chance to, you know, start to understand what's likely ahead and what resources you might need before you end up in a crisis.
So you're saying you've got some of these early warning signs, you've been sucked into doing more and more and more, and you're calling in other family members and you say, whoa, we've got a problem here. What are the things that we should tell people to do? You know, a sister who is, quote, the dysfunctional one that can't do that, who's going to be taking care of mom. How do you protect somebody like that from getting overwhelmed? Because I imagine that for most of us, dementia care can be all-consuming. It
can be, and it's difficult if you're not sitting down with your family members and planning for it and being able to be clear about what's going on. Oftentimes family will be in denial, so you'll have some family members who say mom's fine and some family members who will say that she really needs help. So managing it and talking together is one of the most important things. And I think that if a person who is a caregiver who is providing a lot of the care and who comes up against family members who deny that mom needs help, then that person, the caregiver, really needs to be able to have some resources to get at least some information to help him or herself. Usually it's her. Caregivers are typically midlife women who are caring for kids oftentimes, as well as their elder parent. But finding resources is difficult, but it's really important. And so that's oftentimes what happens with when people have a hard time coming to terms with it, is part of it is because they don't know where to go and what to do.
They're overwhelmed by the thought of all the stuff that's
Right,
ahead of them.
And people don't know where to find information. That's a big issue too.
Well, one of the things we were talking about earlier was the fact that the old family model was you had the extended family was all around, and Grandpa could watch the young ones from the porch while they played in the backyard. But now everything's getting isolated, and the nuclear family has taken over, and so it's sometimes hard to recognize that we're in trouble. Are you able to bridge this with these all-inclusive programs like the PACE programs? And how do you do that?
So within PACE, we look at how the caregiver needs to be supported. And we have a whole team. So we have physical therapists, occupational therapists, social workers. We have a home care program. We have activities therapists. So we assess each individual patient and their family and see what they need. And it's different for each person. We'll provide home health aides to provide assistance with tasks like housework or showering or dressing and bathing. We also will provide some for respite for caregivers if the care is really overwhelming. We have an adult day health center where we can bring people to spend the day, and they have lunch and have activities, and they're safe. If their family member who cares for them works, we look at keeping the patient as functional as possible and making sure that the caregiver has the tools they need, any equipment to help them do as much as they can independently and care for themselves.
I keep seeing this recurring theme is that there's a lot of care that needs to be given, and that you keep coming back to let's make sure that the caregiver is okay. Mm-hmm. Is that a major focus of these PACE programs, caring for the caregiver?
It is becoming, and it certainly is a focus for Summit Elder Care. Because without caregivers who are supported, then the person that they're taking care of isn't going to be taken care of. So we will.
So for the safety of everybody.
Absolutely,
yeah.
Absolutely. So it's very important to us to help caregivers manage the care that they're giving and take care of themselves.
You were hitting a point earlier about the denial as part of the family dynamic now. Mm-hmm. They've given a clinical psychologist a very prime role at Summit. So can you talk about how you deal with denial in the family? I see it all the time in the office as the family mm-hmm. comes in and one person is at her wit's end taking care of mom and saying nobody else is helping out here, and the other family members are saying, well, mom's not that bad. Right. How do you deal with that?
It's tough. So it depends on the family, of course, and it depends on how willing the family members who are in denial are willing to work with us and work with the caregiver. But if the family members who are in denial are not really available to the caregiver, then we work with the caregiver. We work on some of the most important things would be communication skills and knowing where to find resources so that you get the kind of help that you need. Assertiveness training to help people, to help the caregiver know how to say to the people who can help and are willing to help what exactly she needs. A lot of times a lot of families have caregivers, daughters particularly, who will say they should know. And there's not anybody who can
not a
know.
book. There's not a book available.
Right. So whatever kind of help you think you need, nobody really does know. But a lot of times in the families, we don't have really effective ways to communicate what we actually need. There's a lot of family rules about what you can say and that sort of thing. So so helping people through that, helping people find either counselors or resources or the different things that they need. That's all something that here at Summit we can help with.
And in general, in organized programs,
Absolutely.
The PACE programs. How many PACE programs are there in the United States?
Just over 100.
And so this is pretty much a movement across the country. Yes. In terms of how we go about caring for Alzheimer's and for the elderly in general.
Yes, and even before someone might be eligible for a program like PACE, there are resources out in the community. It's often can be helpful if you have a family member with dementia to reach out either to your local area agency on aging. They actually have a program where they'll send someone to evaluate your loved one and help link you with services. And a lot of people don't know that that's something that's readily available. Right.
So most communities have elder services that you can tap into.
They do.
So I imagine that another part of what you're doing is just improving the collaboration among the people capable of giving care. Is that a problem sometimes, improving the collaboration?
Well, when caregivers recognize the value of the team approach, then it's certainly not. It's not difficult to do. They usually welcome it, and we are able to work with them. And a lot of times, even in primary care practices, caregivers who know how to communicate, know how to identify what they need and what's going on, can work with primary care practices too. So I think professionals and caregivers can work together very well. And part of it is knowing, what's out there and what you need. Certainly, calling the area.
Can you give us some idea of what some of the costs of caring are? I mean, their financial costs, social costs.
Yeah. So it takes a lot of time to care for someone with dementia. And most of the care that people receive is informal from family and friends. Even with mild dementia, that can be 13 hours a week. With severe dementia, it's a full-time job. It's more than 50 hours a week that people are spending just helping that patient with their basic activities and doing the shopping and making the meals and helping them get washed up and all of those things. So it just takes a tremendous toll. And either someone is staying home and spending all of that time, or you have to hire help to do that, and it can rapidly become very expensive.
So beyond that, what is the emotional toll that caregiving takes?
So caregiving itself is actually becomes a form of chronic stress. And when part of it is because people don't know what to expect. People, day to day, your workload is high. You're anticipating things happening, and you sort of don't know really when this is going to end, where it's going to go, and so caregivers have the highest level of stress, really, of pretty much any of us. And stress, chronic stress, particularly in the stress for caregivers, can quickly lead to depression. It can lead to anxiety. Caregivers tend to drink and smoke more than other folks. They don't take care of themselves with their health care. They don't eat right. They don't make they don't make their doctor's appointments. All of that kind of stuff. So, so it really it creates a terrible physical toll because all of those behaviors are not healthy. But the physical toll of stress also raises your blood pressure and your heart rate, and it sort of exacerbates the poor lifestyle choices that you're making because you're busy and you're in a hurry and you're not wanting to think about taking care of yourself.
What's your advice to caregivers?
So caregivers, oftentimes some of the best things that can happen are that, number one, that they find time to take care of themselves, whether that's to get out, get a neighbor, talk to a therapist. That's one thing. But even sometimes just finding ways to go to the gym, take a walk, do something fun. One of my favorite phrases is, I like to recommend therapeutic selfishness.
We're coming near the end of our show, and so I'm hoping that you can, there's so much more that we could talk about, but it's been really wonderful having you both here. What I would like you to share with us is some thoughts as to how we should best care for our Alzheimer's patients, some parting thoughts about Alzheimer's.
I would say that it's important to seek help early and seek education about what's likely to happen. Caregivers have a very difficult job, and so there's help available, and they should seek it out and find it.
Well, thank you both. Dr. Susan Hardy and Dr. Brenda King, you have been marvelous guests, and I think that the work that you do is also marvelous, and it's really heartening to see that we're finally moving into more aggressive care for the Alzheimer's patients. That wraps it up for our show. For more information on Alzheimer's dementia and services for patients and families, visit our website at physicianfocus.org. I'm Dr. Bruce Carlin. Thank you for watching.
I'm Dr. Susan Hardy.
I'm Dr. Brenda King.
Alzheimer's disease is the most common form of dementia, a condition that robs patients of memory and impairs their judgment and ability to understand and communicate.
More than 5 million Americans are currently affected, with most of those over 65 years old. But the number of patients with the disease is increasing as our population is aging.
While the effects of Alzheimer's on patients are cruel and tragic, the disease also takes an enormous physical and emotional toll on family and friends who act as caregivers.
A caregiver's burden can take people by surprise and seem overwhelming. The stress and strain can begin early, and it's important to find and use available resources.
So if you are or will be caring for someone with Alzheimer's, act promptly to get help.
To learn more, visit the Caregiver Center of the Alzheimer's Association.
Hello, I'm Dr. Michael Thompson. Diabetes is one of the country's most prevalent chronic conditions, affecting nearly 29 million Americans. The disease is the 7th leading cause of death in the United States and can lead to other serious conditions such as heart disease, blindness, kidney disease, and amputations. Another 86 million people, more than 1 in 3 Americans, are living with prediabetes, and nearly 90% of those are unaware of it. A person with prediabetes has a blood sugar level higher than normal, but not high enough for a diagnosis of diabetes, and without lifestyle changes to improve their health, such as maintaining a healthy weight and getting regular exercise, many patients with prediabetes will develop type 2 diabetes within 5 years. Check with your doctor to get screened and tested, and act today. For more information, visit the American Medical Association at preventdiabetesstat.org.